Every 34 seconds, somewhere in the United States, someone has a heart attack. By the time you finish watching this introduction, it will have happened again. Roughly 805,000 Americans every single year. That is not a rare event. That is an epidemic running in the background of everyday life. And here is the part that most people get dangerously wrong. They picture a heart attack as a sudden dramatic moment. You clutch your chest, you collapse, someone calls 911. That version exists. But in the majority of cases, the body sends very specific warning signals hours or even days before the actual event. Clear, recognizable distress calls from your heart that say something is about to go very wrong in here. The problem is, nobody ever taught you what those signals look like. So when they show up, you call it stress, or fatigue, or a bad night's sleep, and you go right back to your day. By the end of this video, you will know exactly what your body is trying to tell you during that critical 72-hour window before a heart attack. Not just what the warnings feel like, but what is actually happening inside your arteries each time one appears, and precisely what to do the moment you recognize one. If you want health information explained in plain language with no drama and no sugarcoating, subscribe and tap like. The goal for Dr. Johnson is 200,000 subscribers, and you can actually move that number. I share extra checklists and practical health posts on my Telegram. The QR code is on screen if you want to grab those. Before we get to the warning signs, you need to understand what a heart attack actually is, because most people confuse it with something else entirely. Cardiac arrest and heart attack are not the same event. Cardiac arrest is an electrical failure. The heart's rhythm short circuits, the muscle stops contracting, and blood flow to the entire body drops to zero within seconds. A heart attack is a plumbing failure. One of the small arteries that feeds the heart muscle itself gets blocked, and the section of muscle downstream begins to die. Two completely different problems, two completely different mechanisms. Here is the plumbing side. Your heart is a muscle, and like every muscle, it needs its own blood supply. That supply comes through the coronary arteries, small vessels that wrap around the outside of your heart like a crown. They deliver oxygen and fuel directly to the muscle that keeps you alive. Over years, the inner walls of those arteries get damaged by high blood pressure, high sugar, smoking, and chronic inflammation. Cholesterol seeps into those damaged spots, inflammatory cells pile on, and a plaque forms. The opening gets tighter and tighter. Think of a 4-lane highway slowly losing lanes to construction. Traffic still moves, but barely. Then one day, the surface of that plaque cracks, or a blood clot forms right on top of it, and the last open lane shuts down completely. Blood stops. The heart muscle downstream starts dying within 20 to 40 minutes, and that damage is permanent. The critical thing to understand is that this process did not start today. The groundwork took years. And because it took years, your body almost always sends warning signals before that final blockage happens. Those signals are what the rest of this video is about. The first warning sign catches people off guard because it does not feel like a heart problem. It feels like you are just tired. You slept a full night, maybe even a good one. Your day was not physically demanding. You did not run a marathon or move furniture, and yet by early afternoon, you feel a bone-deep exhaustion that coffee cannot touch. Not sleepy, not lazy, drained, as if someone pulled the plug on your entire system and your battery is sitting at 5% for no reason you can name. You push through it, blame it on a bad week, tell yourself you will catch up on rest over the weekend, but the weekend comes and the exhaustion does not leave. Here is what is actually happening inside your body. When a coronary artery is critically narrowed, the section of heart muscle it feeds is chronically underfed. It still contracts, it still pumps, but it works inefficiently, like an engine running on fumes instead of a full tank. To compensate, the heart increases its effort. It works harder to push the same amount of blood, and that extra effort quietly diverts energy away from everything else. Your skeletal muscles get slightly less blood flow, your brain gets slightly less, your digestion slows down, the heart is hoarding whatever it can for itself, and the rest of your body pays the tax. That is why you feel wrecked without a clear reason. The difference between this and normal tiredness is important. Normal fatigue has a cause you can point to, a bad night, a long day, a stressful week, and it resolves with rest. Pre-heart attack fatigue is disproportionate to your activity level, persists across multiple days, and does not improve no matter how much you sleep. Research shows this warning is especially common in women, where it gets dismissed as stress, hormonal changes, or just getting older. It is none of those things. It is a heart running out of fuel. The second warning sign is the one most people have heard of, but almost everyone misunderstands. When you picture a heart attack, you probably see the Hollywood version. A man grabs his chest, his face twists in agony, he drops to the floor. That scene is real, but it is the final event, not the warning. In the days leading up to a heart attack, what people actually feel is something much more subtle, an episodic chest pressure, a tightness, a squeezing sensation that shows up when you climb a flight of stairs, carry grocery bags from the car, or even during an argument, and then fades completely when you stop and rest. In medicine, this pattern has a name: unstable angina, and it is a direct signal that your heart muscle is temporarily not getting enough blood. Here is the mechanism. A coronary artery that is narrowed by plaque can still deliver enough blood to the heart muscle when you are sitting quietly. Demand is low, supply is tight but sufficient. But the moment you exert yourself, your heart rate increases, the muscle needs more oxygen, and that narrowed pipe simply cannot deliver enough. The muscle downstream starves briefly, and you feel that pressure across your chest. When you stop and rest, demand drops, supply catches up, and the feeling fades, so you call it indigestion, or a pulled muscle, or anxiety, and you move on. That is the dangerous part. What separates this from acid reflux is specific and worth memorizing. Cardiac chest pressure tends to spread across the chest rather than sitting in one sharp spot. It often radiates to the left arm, the jaw, or the upper back. And critically, it is provoked by physical effort or emotional stress, not by eating. Episodic chest tightness that shows up with exertion and disappears with rest is textbook unstable angina. That is not a wait-and-see situation. That is a reason to be evaluated urgently. The third warning sign is the one that fools the most people, because the pain shows up nowhere near your heart. It shows up in your jaw, in your left shoulder, between your shoulder blades, in your upper stomach. And because it lands in those places, you go to the dentist, you blame your mattress, you take an antacid, and you never once think about your coronary arteries. This is called referred pain, and understanding it could save your life. Here is why it happens. Your heart does not have its own dedicated pain hotline to your brain. It shares nerve pathways with several other parts of your body, specifically the jaw, the left arm and shoulder, the upper back, and the upper abdomen. When heart muscle is in distress, it sends pain signals up through these shared nerves. Your brain receives the signal, but misreads the return address. It interprets the message as jaw pain, not heart pain, and so you react to the wrong problem. Let me walk you through what each one actually feels like so you can recognize it in your own body. Jaw pain, that feels like you have been clenching your teeth all night, except you have not. It aches on both sides, or just the left, and it comes on during a walk or while climbing stairs, and then fades when you stop. Left arm heaviness, or a dull ache that you cannot connect to any injury, any movement, or any sleeping position. A burning or pressure between your shoulder blades that appears during exertion and disappears with rest, and feels nothing like a normal muscle knot. Upper stomach discomfort that mimics indigestion, except antacids do nothing, and it has no relationship to what you ate. Each one of these, in isolation, has a perfectly innocent explanation. That is exactly why they get missed, but the pattern is what matters. If any of these appear suddenly, have no clear mechanical cause, come and go with physical effort, and resolve when you rest, the origin may be cardiac. That possibility needs to be ruled out, not explained away. You just learned that heart attack warning signs can disguise themselves as a toothache, a sore shoulder, or indigestion. That is exactly why so many people miss them, and here is what I see in practice. Most people will watch this, feel concerned for a few minutes, and then go right back to their day without doing a single thing. I do not want that to be you. There is a free platform called Care Health that connects you with healthcare options, cardiac screenings, blood pressure monitoring programs, and clinical trials for heart disease right in your area. You fill in a short form, your date of birth, gender, whether you have children under 18, and that is it. Takes 30 seconds, costs nothing, no commitment. Care Health matches you with relevant options near where you live. Click the link in the description or scan the QR code on screen right now. If you are watching on your phone, tap the channel profile picture to find the link. Now back to the warning signs your body sends before a heart attack, because the next one is the one that surprises most people. The fourth warning sign has nothing to do with pain. It has to do with air. You are sitting on the couch, watching television, not exerting yourself in any way, and suddenly it feels like you cannot get a full breath. You inhale, but the air does not seem to go deep enough. Or you wake up in the middle of the night with a strange feeling of suffocation, and the only way to breathe comfortably is to sit upright or prop yourself up on pillows. Nothing about your day explains it. You did not run. You did not climb stairs. You were resting, and your lungs decided that resting was not enough. Here is what is happening inside your chest. When a coronary artery is critically narrowed and the heart muscle downstream is underfed, the heart's pumping efficiency drops. It cannot move blood forward through the body as effectively as it should. Blood starts to back up, and the first place it backs up into is your lungs. As pressure builds in the lungs' blood vessels, fluid begins to seep out through the vessel walls into the tiny air sacs where oxygen exchange happens. Those air sacs are supposed to be dry and filled with air. Now they are partially waterlogged. Your lungs become like a sponge that someone squeezed halfway and then dropped in a shallow puddle. Your brain reads that reduced oxygen exchange as one thing: suffocation. This is called pulmonary congestion, and it is one of the earliest signs that your heart is failing to keep up with demand. The way to tell this apart from asthma or anxiety is specific. Cardiac breathlessness typically worsens when you lie flat, because gravity spreads the fluid evenly across both lungs and covers more air sacs. When you sit up, gravity pulls the fluid downward. The upper portions of the lungs clear, and breathing becomes easier. That positional pattern is a strong clue. It may also come with a heaviness in the chest rather than the throat-tightening sensation of a panic attack. New, unexplained breathlessness at rest, especially if it pulls you out of sleep, is not something to monitor for a week. That is a reason to be evaluated the same day. The fifth warning sign is a cluster, not a single symptom, and it catches people completely off guard because it feels more like food poisoning than a heart problem. You break into a cold, clammy sweat even though the room is not hot and you have not moved from your chair. Your stomach turns. Nausea rolls in. The room seems to tilt or drift slightly, and you feel lightheaded without standing up or changing position. This triad, cold sweats, nausea, and lightheadedness, often appears together, and it is one of the most commonly missed pre-heart attack warnings, especially in women. Here is the mechanism. When your heart is in acute distress, your autonomic nervous system, the system that runs your body's background operations without any conscious input from you, goes into emergency mode. It activates a full fight-or-flight response even though there is no external threat. Adrenaline floods your bloodstream. Blood vessels in your skin constrict sharply to redirect blood toward your vital organs, your heart, your brain, your kidneys. That is why the sweat feels cold and clammy rather than warm. Your skin is not being cooled by evaporation, it is being drained of blood flow. At the same time, the vagus nerve, a major nerve that connects your brain to your digestive tract, gets stimulated by the cardiac distress signal. That stimulation produces nausea, sometimes vomiting, sometimes just a heavy, sick feeling in your stomach. Blood pressure fluctuates rapidly, which is why the room seems unsteady. People blame this on something they ate, low blood sugar, a hot flash, or just a weird moment. The distinguishing feature is that this cluster appears without a clear trigger. You did not eat anything unusual. You are not in a hot room. You are not standing up too fast. It just hits, and it may come in waves over hours or even days. If cold sweats and nausea show up alongside any of the other warning signs we have already covered, that combination moves the urgency from get checked soon to get checked now. Now I want to talk about the myth that puts more people in danger than almost anything else I see in practice. The myth is this: my cholesterol is fine, so my heart is safe. That single belief has given a false sense of security to millions of people who are walking around with coronary arteries that are quietly closing. Here is the reality. Roughly half of all heart attacks occur in people whose cholesterol numbers fall within what most lab reports label as normal. Half. That is not a small margin of error. That is a coin flip. The reason is that cholesterol is one ingredient in the process, but it is not the whole story. Think back to the endothelium, that microscopically thin lining on the inside of every artery. When that lining is healthy, cholesterol particles flow past it without sticking. When it is damaged, everything clings. And what damages that lining has nothing to do with cholesterol itself. Chronic inflammation damages it. Insulin resistance damages it. High blood pressure physically batters it with every heartbeat. Smoking delivers a direct chemical assault to it with every cigarette. A person with textbook perfect cholesterol but uncontrolled blood sugar, chronic stress, and years of high blood pressure can have coronary arteries that are heavily diseased. Conversely, someone with moderately elevated cholesterol but a healthy endothelium and low inflammation may have clean vessels. Cholesterol is what fills the cracks, but it is the cracks that start the problem. That is why some cardiologists recommend a coronary artery calcium score, a scan that directly measures how much calcified plaque has already built up in your coronary arteries, rather than relying on cholesterol numbers alone. It shows you what has actually happened inside your vessels, not just what is floating in your blood. The second myth is quieter, but equally dangerous. I would feel it if something were wrong with my heart. No, you would not. Coronary artery disease is often completely silent for decades. The arteries narrow year after year, plaque accumulates layer by layer, and the person feels absolutely nothing. In many cases, the first symptom is the heart attack itself. That is exactly why the warning signs we have been discussing are so critical. They may be the only advance notice your body gives you. If you miss them, the next event may not come with a warning at all. Now, the most practical part of this video: what do you actually do if any of those 5 warning signs have already shown up in your life, even once, even briefly? Even if they disappeared on their own, you have a window, roughly 72 hours, where a great deal can still be done to prevent a full heart attack or minimize the damage if one is developing. The goal is not to panic, it is to act while there is still time to act. First, do not drive yourself. This is the same logic that applies to transient ischemic attacks before a stroke. If your heart rhythm becomes unstable, if you lose consciousness, if chest pressure hits while you are behind the wheel at highway speed, you endanger yourself and every person on that road. Tell someone close to you exactly what you felt and when it happened. Ask them to stay reachable over the next couple of days. If you live alone, that conversation is even more important, because if a more serious event happens and you cannot speak or call for help, you need someone who knows to check on you. Second, do not dismiss a symptom just because it resolved on its own. A warning sign that came and went is not proof that you are fine. It is proof that your heart was temporarily in trouble and managed to recover that time. The underlying problem, the narrowed artery, the unstable plaque, is still there. Third, know what will happen when you get evaluated, so it does not feel like a mystery. Emergency teams will typically run an ECG to check your heart rhythm and look for signs of damage. They will draw blood and test for troponin, a protein that heart muscle cells release when they are dying. If needed, they may order imaging to look at blood flow through the coronary arteries. Having a written list of all the medications you take and a plain language description of your symptoms and when they happened saves critical minutes for that team. Fourth, know when to call emergency services immediately. Any chest pressure that lasts more than a few minutes without fading, any combination of 2 or more warning signs appearing at the same time, or any single symptom that resolves and then comes back, those are not wait until Monday situations. Those are call right now situations. You can ask your doctor in advance how they would want you to act if you ever suspect a cardiac event, so you are not guessing in the moment. Stepping back from the emergency side, let me talk about what actually protects your coronary arteries over the long term, because heart attack prevention is not abstract. It is not eat healthy and exercise. It is a set of specific, measurable, targetable risk factors that you and your doctor can track with real numbers. The first is blood pressure. Chronic hypertension physically batters the walls of your arteries with every single heartbeat. Over years, that repeated force damages the endothelium, accelerates plaque formation, and weakens the vessel structure. The goal is not to crash your blood pressure as low as possible. It is controlled, stable pressure managed with your doctor's guidance, avoiding both extremes. The second is blood sugar. We covered this with the endothelium earlier. Even pre-diabetic glucose levels, numbers that no one has officially called diabetes yet, are enough to injure the lining of your coronary arteries quietly for years. An HbA1c test catches that damage where a single fasting glucose snapshot does not. If you have never had one, that is a conversation worth having at your next visit. The third is smoking. Every cigarette delivers a direct chemical assault to the vessel lining and simultaneously makes your blood thicker and stickier. You are damaging the pipe and thickening the sludge inside it at the same time. Quitting reduces heart attack risk measurably within the first year, not in a decade, within months. The fourth is physical activity, and the key word is regular. Not a single heroic walk on Sunday. Consistent, repeated movement across the week is what sends the signal that keeps your cardiovascular system adapted and efficient. 5 to 6 shorter walks per week does more for your arteries than one long weekend effort ever will. The fifth is stress. Chronic psychological stress elevates cortisol, raises blood pressure, drives systemic inflammation, and pushes people toward the very behaviors that accelerate arterial damage: overeating, smoking, skipping activity, poor sleep. Managing stress is not a luxury addition to heart health, it is a core component. None of these are vague lifestyle suggestions. Every single one can be measured, monitored, and actively controlled. That is what makes heart attack prevention concrete. Your doctor can give you the numbers. Your job is to ask for them. Here is what you now know. Your body does not stay silent before a heart attack. It sends 5 specific warning signals, and you can recognize every one of them. Unexplained deep fatigue that does not match your day and does not improve with rest. Episodic chest pressure that appears with effort and fades when you stop. Referred pain in the jaw, shoulder, upper back, or upper abdomen that has no clear mechanical cause and comes and goes with exertion. Shortness of breath at rest or when lying flat, especially if it wakes you from sleep. And the triad of cold sweats, nausea, and lightheadedness appearing together without an obvious trigger. Any one of these showing up for the first time, even if it lasts only a few minutes, even if it disappears completely, is a reason to be evaluated. Not next month, not when it happens again. Now, here is what to do after this video. If you recognized any of those 5 signs from your own life, even from weeks or months ago, write them down in plain language and bring that list to your doctor. Do not rely on memory. Ask specifically whether you should be evaluated for coronary artery disease and whether cardiac screening, blood work, or monitoring makes sense in your case. And remember, that free cardiac screening link from Care Health is in the description. 30 seconds could make a real difference. Take care of yourself. Everything we covered today is for your understanding and education. Your situation is specific to you, and using this as a starting point for a real conversation with your doctor will always be more useful than trying to manage things on your own. If this made a complicated topic easier to follow, subscribe to Dr. Johnson and hit like. That is how we reach more people before the warning signs turn into something permanent.